Well, hello everybody, and welcome. So as you know, we encourage patients and the public to measure their blood pressure at home. But are those devices actually accurate? Inaccurate devices could be quite misleading, actually, leading to either undertreatment or overtreatment of hypertension. When I first got involved, I had no idea that manufacturers weren't actually required to validate their devices. So to address this concern, Hypertension Canada has created the device recommendation program, and you can see the website here. Manufacturers can submit their validation data, and they're reviewed by our experts according to international standards. So at this point now, what I'd like to do is just show you these are the symbols that indicate the devices that we recommend. You'll notice for some of you on the far right-hand side is our new logo for this. So without further ado, I'd like to introduce our moderator for this webinar, who is the chair of our device recommendation program, Dr. Swapnil Hiremath. Dr. Hiremath is a nephrologist at the Ottawa Hospital and an associate professor in the Faculty of Medicine. He's cross-appointed to the School of Epidemiology and Public Health at the University of Ottawa and an associate scientist in the Clinical Epidemiology program at the Ottawa Hospital Research Institute. His medical education has been at the University of Mumbai and the University of Ottawa. He also has a master's degree in public health from the Harvard School of Public Health and certification from the American Heart Association as a clinical hypertension specialist. His primary research interest is in using knowledge synthesis with hypertension and patients with acute kidney injury. He has authored over 150 papers and is also the co-creator of the Twitter-based nephrology journal club, NephJC, and a panelist on the Freely Filtered podcast. He also writes for the American Journal of Kidney Diseases blog. Please join me in welcoming Dr. Hiremath.
Thanks, Ross, for that introduction. Again, I'd like to reiterate what Ross said, which is that it's really important to have your blood pressure devices validated from the manufacturer's end, but from your end, from let's say you're a healthcare professional or a patient, how do you know that a device is validated? So this is where the Hypertension Canada website is useful. You can go to the website and see which blood pressure devices Canadians use are safe for everyone. As Ross mentioned, we want to encourage device manufacturers to submit their BP devices so that both healthcare professionals and the practicing professionals, as well as the people, can use them with peace of mind. Now let's get on with the program that you're all waiting for today. So I'd like to introduce our first presenter, Dr. Dean Picone from Down Under, where it is 6 a.m. So we are very happy he is awake early and bright to present to us from across the globe. Dr. Picone is a senior research fellow at the University of Sydney. He has published over 50 papers, largely with a focus on blood pressure measurement. So he's really the expert that we need today to talk to us about the importance of validation. He has original research articles as well as review papers on this issue related to validated blood pressure devices. Please join me in welcoming him today. Thanks, Dr. Picone.
Yes. So thanks very much for the opportunity to come and talk to you today, all the way from Australia. It's an honour to be here, and I'm going to take you through an overview of non-validated or validation and unvalidated blood pressure devices, and specifically sort of focus in on the research that I've done in this area. So just a brief overview of what I'm going to talk about today. I'm going to give a brief introduction and then talk about my research on unvalidated devices, how to find validated devices, and then also talk about steps required to achieve exclusive use of validated devices. So high blood pressure, just by way of brief introduction, high blood pressure is rarely accompanied by symptoms. So that means simply that it must be measured to be identified. And automatic blood pressure devices, so those that are sort of a press button type scenario, are widely recommended, and they usually measure blood pressure using the oscillometric technique. So clinical validation of these automated blood pressure devices is universally endorsed by scientific entities around the world. And the reason that we need validation is because these automatic and semi-automatic blood pressure devices have proprietary algorithms to estimate blood pressure. So each device may be different in the way that it measures blood pressure. And another reason that we need to validate blood pressure, automated blood pressure devices is that the original sort of evidence around the clinical risk related to blood pressure was largely generated from the manual mercury sphygmomanometry measurement technique, which uses stethoscope to listen for the Korotkoff sounds in the brachial artery. So just by way of defining a couple of the things I'll be talking about today. So device validation studies are when there's rigorous clinical testing of an automated blood pressure device according to a standardized protocol to determine accuracy. And a validated device is a blood pressure device that has passed these validation protocol requirements. So you might immediately ask, why do we need to use validated devices? I'm not going to go into all the evidence, but they're essentially measurement of blood pressure from validated devices is more accurate and more precise than from devices without any evidence of validation. So a lot of the work that I've completed has stemmed from the Lancet Commission on Hypertension, which provided 10 recommendations around improving the control, essentially, of raised blood pressure. And one of those was measurement quality. And you can see here, they recommended improving the quality of blood pressure measurement through endorsed protocols and certified and validated blood pressure monitors. So a lot of the work that I'm going to talk to you about has been completed under the Valid BP project, which is research and advocacy on the use of BP devices that are validated for accuracy, which is led by Professor James Sharman. And at various times, we've worked with these different groups around the world. And a lot of what I'm really going to talk to you about is understand the first step on what the scale of the problem is. So the first study I want to talk to you about is a study we conducted in the Australian context, and it was understanding the number of validated and non-validated devices that are available on the online marketplace in Australia. So we performed a pretty exhaustive search of Google using a number of different search terms to identify blood pressure devices that were available to Australian consumers. And the websites that we identified, they needed to either have a physical presence, as in a physical store in Australia, or they shipped to Australia. And essentially what we found was that of the blood pressure devices available for purchase, for upper arm cuff devices, which are the recommended devices, we found 278 unique devices, of which 51 had proven accuracy according to international validation standards. So that was around just under 20% of devices. We also identified 162 unique wrist cuff devices. So those are typically not recommended in guidelines in any case. And only 8% of those were validated for accuracy. We also identified an astounding number of wristband wearable devices. Now, these devices, we didn't find any of those were validated, and these devices were not necessarily some of the current cuffless devices which are starting to be developed on the market, but more quite cheap activity tracking style devices that purported to measure or give you a measurement for blood pressure. We were a little bit skeptical, but I bought a couple of these and did find that they would actually give you a blood pressure number. And so, but they were, at least from my testing, so it's quite anecdotal, they were quite inaccurate. So we looked at 4 different types of businesses. within this study and looked at the percentage of devices that were validated. And so we can see that for pharmacies in Australia, 24% of devices were validated. For medical style suppliers, nearly half of the devices they sold were validated. For general retailers, so that's like electronics stores and that kind of thing, 43% were validated. And the e-commerce providers, so those are the stores that only have an online presence, just 5% of devices were validated. We also identified that validated devices are more expensive, and the reason for that is probably due to the cost associated with actually performing a validation study and and everything associated with that. So the conclusions that we drew from this study were that most devices available in Australia are not validated for accuracy. Those devices are cheaper and are most commonly available from e-commerce businesses. So that really raised some alarm bells for us and identified that we really do need to do something about this issue because it was a major issue. But we did also note that just under 1/4 of devices were validated among Australian pharmacies, and so we wanted to understand the awareness of this issue among Australian pharmacists. So we conducted a survey in collaboration with some pharmacy colleagues from the University of Tasmania. And we distributed this nationwide, and we found that 94% of pharmacists consider the accuracy of the devices that they sell to be important. But 90% were unaware that less than 1/4 of the devices that were sold by Australian pharmacies were validated. Now, I just want to point out, it's not unexpected, these findings, because it's reasonable for pharmacists to expect that the devices that they sell, which have been approved by regulatory authorities, have been appropriately tested for accuracy. And so we concluded from this study that education and advocacy towards exclusive sale of validated blood pressure devices in Australian pharmacies is required. So that's a snapshot of the Australian context that I've been talking about so far, and I just want to shift towards the more global work that we've done more recently, because we wanted to then understand essentially if what we had found was representative of the global situation. So one study that we published last year was of the Medival database of blood pressure devices. So this is a large international database, and the unique feature of it is that it contains both validated and non-validated devices on the database. So when you look up devices, it will tell you if there is no evidence of validation, essentially. And so just to finish that point, so that's slightly different to the Hypertension Canada model, where it's only validated devices that you'll see on the list, and that's typically the case for most other validated device lists. So we wanted to determine if the results on availability in Australia were representative of the global situation. And from this study, from analysing the database, we identified over 3,400 unique automated BP devices. And 76% of these had no evidence of validation for accuracy. And that included 73% of upper arm cuff devices and 85% of wrist cuff devices. So these results are reasonably consistent with the findings from Australia. And so we concluded that most blood pressure devices available globally have not been validated or have no evidence of being validated for accuracy. Now, one thing that we are still uncertain of was sales data. So what devices, so we've talked about a lot about availability so far, but what devices are actually being purchased? And this is a really hard nut to crack, because most sales data is not available publicly. So what we did do recently, though, was have a look at Amazon, which is a global e-commerce business. to try and get a handle on the devices that at least Amazon may be selling. So they produce, Amazon produce a best-selling list, which a higher ranking out of 100 is the most, said to be the most popular based on sales. There are some other things that go into the Amazon algorithm, but it is essentially based around sales. And we found that 10 Amazon stores from different countries around the world had best-selling blood pressure device lists, which we could access. And we recorded data every fortnight at the same time of day for all 10 countries. And the data there was a lot of data to process, as you can imagine. It was highly consistent between each fortnight. So we analysed the data from every 8 weeks across a 12-month period of observation. And we captured data on the device model, the cost of the device, and also the consumer ratings, which was total out of 5 stars, and the total number of ratings. And we determined validation based on the standard validation device lists that are used for globally, which is the Stride BP and the MetaVal. So those are sort of international device validation lists. And if it was found to be validated on either of those lists, we said it was validated. And we also used, for each specific country that actually has a validated device list, we also searched that list for that specific country. So as you can see here, for Canada, we also additionally searched the Hypertension Canada list to identify if devices were validated, because sometimes devices that are listed on one list, for example, Hypertension Canada, may not be found on the Stride and the MetaVal databases, and that can just be due to regional differences or manufacturers submitting their information about validation status just to one listing. So what we found was that there was different levels of validation of upper arm cuff devices between different countries. So the highest percentage of validated devices was for Germany at 35%, and the lowest was Australia and India. And so this showed a bit of regional variation, but still, even Germany, that means that 65% of the devices were non-validated. So that's still the vast majority of devices on the bestseller lists being non-validated. As per the Australian data as well, we found that non-validated devices were cheaper than validated devices. And that cost data was quite consistent across countries, so we standardised the cost data for US dollars, and you can see that for every country, the validated devices cost more than the non-validated devices here. Interestingly, although we can't necessarily draw too much from this, we found that the consumer ratings were similar between validated and non-validated upper arm cuff devices. The reason I say we can't draw too much from this is we're not sure how easily consumer ratings on Amazon can be gained, or essentially there may be illegitimate reviews. So essentially what we found from this study was that non-validated devices are being sold and are highly prevalent on Amazon best-selling lists. They're cheaper than validated devices, and there were similar consumer ratings. So I just want to start to wrap up with a bit of a broader view on what we actually, I've sort of spoken a lot about problems so far, or finding that there is quite a big problem that we need to address. So there is also a lot of work going on what we need to do next. What are the next steps? So this was there's just been a special issue published in the Journal of Human Hypertension on this topic. And this is a consensus statement on the urgency to regulate validation of automated blood pressure devices. And so there are a bunch of recommendations for governments in particular to use. So talking about building strong regulatory capacity for independent validation testing, regulation of sales, marketing and packaging, regional lists of validated devices, as I just alluded to in the Amazon work, but making sure that different regions of the world have lists that are specific to their region. And policies to ensure equitable, affordable access to validated devices as well is important, because as we've shown, non-validated devices are much cheaper, and that may draw consumers towards those devices who may not have as much money to be able to afford a validated device. There are challenges associated with conducting validation studies, which I think is important to point out. One of those is cost. Another is incentive. As was mentioned earlier, most regulatory authorities don't require independent clinical validation of blood pressure devices according to the rigorous standardized scientific standards. This is a really good paper, again in that special issue with industry perspectives on the use of validated blood pressure measuring devices. And I think it's very much worth the read. I just wanted to also touch on cuffless devices because there are a number of very innovative devices that are starting to come out in this space. As you can see, this image from a paper in the Journal of Hypertension shows the increasing interest in cuffless technology. There are validation protocols that are currently under development. It's a bit more complex than for cuff devices. Obviously, we need to know if they're accurate, but in particular, we need to know if they're accurately track blood pressure changes. And so one thing that's been suggested is perhaps doing BP challenges to assess accuracy. So stuff like cold pressor tests or Valsalva maneuvers or other exercise-based tests, because these are devices that will be worn throughout the day, not just while people are sort of sitting in a standardized situation. And also understanding stability over time, because a lot of these cuffless devices require cuff calibration. And I just wanted to finish by sharing a couple of resources. So what you can do now to find a validated device. We published this paper a couple of years ago in collaboration with the Accuracy Measurement of Blood Pressure Collaborative. And we produced a series of resources. They're available in a number of different languages. It can be accessed through the QR code. And we provided information about country-specific registries and also the general registries that I mentioned earlier, Stride, BP, and Medival. As you can see, I've circled Canada there. And this image has already been shown earlier for your Hypertension Canada list, which I thoroughly recommend you look at. So take-home messages. Most blood pressure devices available to consumers have no evidence of passing clinical validation testing for accuracy. E-commerce providers have the highest availability of non-validated devices, even among bestseller lists. So it really shows that consumers really need to be cautious if they are looking to purchase a blood pressure device through e-commerce methods, and really need to check those validated device lists. So there's a really urgent need for advocacy, education, and capacity building to achieve exclusive use of validated blood pressure measuring devices. Well, thanks very much for your attention. I'm certainly very happy to take questions, I think, at the end of the webinar.
Perfect. Thanks, Dr. Picone, for that wonderful presentation. As you said, we know high blood pressure is bad, but if we don't measure it properly, we hardly can treat it properly. Please, I can see some people have already putting in questions in the question tab. So please go ahead and keep doing that. Put in all your questions in the question tab, and we'll come back to all the questions for both of the presenters at the end of the second presentation. Which brings us to the second presentation, and we are fortunate to have our second speaker, Jonathan Chan. Jonathan Chan is a Doctor of Pharmacy student at the University of Alberta. He is a research assistant at the Epidemiology Coordinating and Research Center, EPICOR, at the University of Alberta. He is interested in patient care, SGLT2 inhibitors, and cardiovascular disease. and his goal is to become a clinician researcher caring for his patients while improving patient care through research. He has recently done some work on the availability of validated home blood pressure devices in Canada. So what Dr. Picone showed in Australia and globally, we have some more granular data from Canada that he'll be sharing with us today. Please join me in welcoming him today, Jonathan.
Okay, thanks so much, Dr. Hiremath, for that kind of introduction. Can everyone see my screen and hear me clearly?
Yeah, go ahead.
Okay, great. Okay, so yeah, today I'll be sharing a little bit more about, from the Canadian context, about the current state of the validity of home blood pressure devices sold here in Canada. So I believe most of the attendees here are from Canada, so I'll give you a little bit of a sneak peek into what we found. But first, this is kind of the roadmap for today. So we'll get started with the background. So we know that 1 in 4 Canadians have hypertension. So it is a serious epidemic in our country and in many countries around the world. And we know that home blood pressure monitoring is an important tool in the management of hypertension, in checking if the antihypertensives are working well for the patient's adherence, etc. And we have the fantastic Hypertension Canada recommended blood pressure devices recommendation on the website, and this is based on international standards such as the ISO and the United States AMI. And as Dr. Suki already showed, here are some of the symbols and stickers that you will find on the blood pressure devices sold in Canada, with the gold and the silver symbol, and this is the website, which can be found here. However, concerningly, globally, as Dr. Picone, in his study, he found that globally 76% of blood pressure devices are unvalidated. And another study in Canada showed that home blood pressure devices are not accurate to within 5 millimeters of mercury. And the proportion of devices with systolic or diastolic BP differences from auscultation, which is the gold standard of 5, 10, and 15 millimeters of mercury, was found in 69, 29, and 7% respectively of the devices that were tested. And this has, as you may know, with the SPRINT criteria and with the hypertension guidelines, the categories for the target and treatment are often within 10 millimeters of mercury. And this could lead to big implications such as incorrect diagnosis, overtreatment, or undertreatment of hypertension. And it is also not widely known that validation is not required, and many devices are unregulated. So, as mentioned, recently there was the 2023 call to action from the World Hypertension League urging for the more accurate and validated blood pressure machines. So this is where we got interested alongside with Ian Vandermeer. We looked at the current state of the validated blood pressure devices available in Canada, and we also compared blood pressure devices available online in franchise pharmacies and also independent pharmacies here in Canada. So this is how we did it. So last year we did a cross-sectional study. We secretly visited 16 community pharmacies in Edmonton, 7 major chains, such as Shoppers Drug Mart, Rexall, etc., and also 9 independent pharmacies, so pharmacies owned by independent owners under their own banner. And we also went online and looked at retailers that had an online and also brick and mortar stores such as Walmart, Best Buy, and Canadian Tire, and also the ever popular Amazon. And we tallied up all the different model numbers and compared it with the Hypertension Canada website. So we'll cut to the chase and go to the results. So this is what we found. We found that around 63% of the devices that we found, we looked at 170 devices, and 37% of them were unvalidated. So that is still a big chunk that is not validated, and that, as I mentioned, with the implications of not having a validated machine can be. And this is the breakdown of what we found by pharmacy. So interestingly, we looked at pharmacy, and we believe that this may be the first study that looked at pharmacies in Canada, looking at what blood pressure devices were available, and we found that around 90% of the blood pressure machines were validated, which is quite high compared to online, which was very low at 45%. And another interesting finding was that 100% of all the blood pressure machines that we found in independent pharmacies were validated. And we suspect that maybe it's because of the owners of the pharmacies that have more control of what blood pressure machines are available in their pharmacies, and also just they had lower amount to choose from as well. So maybe they were a little bit strict on what machines they carried. And for online, it ranged from 30% to 65% being validated. So there's a big range, especially online, and overall 45%, which is less than half of the machines being validated. And regarding cost, not surprisingly, validated blood pressure devices were more expensive than non-validated blood pressure devices, around double the price of non-validated devices at around $96. And for non-validated devices, it was around $50. So yeah, this could be a big factor for patients that are choosing a blood pressure machine, and factoring in the cost, they may choose a lower cost option for affordability. So from our results, we found that the majority of the devices sold in pharmacies are Hypertension Canada approved, and online retailers, however, had a very low percentage of validated blood pressure devices available. And compared to Dr. Picone's studies, we are sitting a little bit higher. His study for the global was 23% being validated, and his study with Australian online retailers was at 6.6%, while we were looking at, in Canada, pharmacies online, and we found that it was around 63% validated. So with our results, knowing that only around 45% are validated online, and also knowing how online retailers are even getting more popular, and the number of unvalidated BP devices are also getting more popular, there needs to be more public education and chatting with our patients and in recommending appropriate validated blood pressure devices. So we had a few limitations with our study. We only sampled pharmacies from the Edmonton area only. However, our results are likely generalizable. Chain pharmacies use the same wholesalers across Canada, and independent pharmacies only have limited number of wholesaler suppliers that they can choose from. So we believe that these results are generalizable to the rest of Canada. So to end off my presentation, I just wanted to share a few take-home messages for you. So we know that many home blood pressure devices sold in Canada are not validated, and only 62% are validated. And online retailers have concerningly low number of blood pressure machines that are validated, only at 45%. And from this, with unvalidated devices, even a 5 to 10 millimeter mercury difference can result in overdiagnosis, undertreatment, and incorrect diagnosis. So with this reality, I think what we can do to combat this, our best option right now, and what we can do, something that's actionable, is to refer our patients, our fellow clinicians who may not know about the Hypertension Canada's recommended blood pressure device list, and also share how you can find the status on the boxes of the blood pressure devices before purchasing. So I'd like to conclude my presentation and hand it back to Dr. Hiremath. Thanks for listening.
Thank you, Jonathan, for that great study. Thanks for doing the study, and for replicating the findings. It's interesting how overall the data goes in a similar direction, though the absolute numbers are quite different in Australia versus Canada. For all the attendees, please go ahead. There are some questions I can already see are there in the panel, and I'll be looking at that and asking that to the panelists. But let's start off with a question for Dr. Picone. There's a lot of interest about, I think there is some confusion still about what is validation and what does it do. So can you explain a little bit about, what are the protocols or standards for validation, and a little bit more of that detail?
Yeah, absolutely. Sorry, just checking you can hear me.
Yeah, you're audible. Go ahead.
Just unmuted again. Okay, that's great. Yeah, so that was one thing I didn't really cover too much, and so I'm very happy to provide a bit more context. So there are, to provide a bit of context, the first validation protocol was developed in 1987, and so what the purpose of that was I think there'd been quite a lot of, from what I can understand from the literature, there'd been a lot of testing of blood pressure devices for accuracy. The first automated devices had come on the market about 10 years earlier. So there was a need to understand how these automatic devices compared to manual sphygmomanometry. And so there have been several different validation protocols that have been used over the years that have been accepted, generally accepted by scientific organisations. However, recently, the key, I guess you could say, the key global players have come together and developed a consensus, and there's now a single ISO standard that is regarded as the international protocol, if you want to call it that, for validation of blood pressure devices. So what is required for that is a test device, which is the automatic blood pressure device, being compared to the reference, which is manual sphygmomanometry. And what we need for that protocol, there are quite stringent requirements. So you need to have, for a general population, which is an adult population, 85 participants with at least 30% women, 30% men, a range of different arm sizes, because we need to check that the different cuff sizes that are supplied with devices work appropriately. Different ranges of blood pressure, because there can at times be scale-dependent bias related to the accuracy of blood pressure measuring devices. For certain populations that are called special populations, which really all that means is there's clear evidence that blood pressure can be measured is measured more inaccurately. There are specific requirements within this ISO statement. So that is children, pregnant women in particular. And I think that a very large arm size is potentially being considered as a special population, but I'm not sure that has occurred yet. I think that covers the fundamentals of it for now, but I'm happy to provide more context if required.
Exactly that, and just to say where we are going in Canada is, you have seen the gold and the silver logo, and that was because previously, as Dr. Picone alluded, there were several different standards, and we wanted to give benefit of doubt. So if someone had used a certain standard, we said silver, and if someone had used another standard, a slightly more rigorous standard, we had the gold logo. Since the universal standard has come into place, we are moving towards just a single check mark saying, hey, this is approved through the universal listing, and you will see that being rolled out in the near future. Now let's go back to Jonathan now with your study on general retailers and online. So if there's a patient or a provider looking at, hey, where should I buy a blood pressure monitor from? There's a dramatic difference between online and what you saw in pharmacy. Do you have any specific advice saying, hey, don't buy from Amazon or anything like that?
That's a great question, Dr. Hiremath. And I think the best is just to look at the Hypertension Canada recommended device list, regardless if you buy online or also in pharmacies, even though pharmacies do carry many more blood pressure devices that are validated. However, on Amazon, they also carry some. So I recommend that patients look at the device and check out the serial number and match it up with the Hypertension Canada list, and also talk with your pharmacist and also other healthcare providers that can help you out.
Exactly, and I think in Canada, perhaps our pharmacists might be more educated. But Dr. Picone, what explains this huge difference? There was this disconnect between pharmacists' awareness and what they were selling. We also saw in Canada that the blood pressure devices sold at the pharmacies were pretty good, like 89% were validated, whereas it was the opposite. That result was sort of discordant in Australia, where online was perhaps a little bit better, or general retailers at least were a little bit better, not online, compared to what was being sold at the pharmacists. Is there a difference in what pharmacists sell in Australia, why the number was lower for validated devices?
I think there's probably a few reasons for the difference. So we searched online pharmacies, which cover most of the large chain pharmacies and captured some of the smaller pharmacies. We potentially missed a few independent pharmacies, but there are, from my understanding, quite a few left now in Australia. So that may be one reason that we found a slightly lower proportion of validated devices. I think the other thing that's probably important to note, or the reason for perhaps the disconnect, is Australia doesn't have a scheme like Hypertension Canada with the recommended logo. So I think that's probably critical to awareness as much as anything. I think Hypertension Canada and the activities that are being conducted is sort of the gold standard, to be honest, worldwide in hypertension. The hypertension control rates in Canada compared to Australia are vastly different as well. We're sitting on about 32% control of hypertension in adults. So I think there's probably a few factors slightly related to study design, but also that issue around awareness and understanding exactly what a validated device is.
Yeah, that's it. So I wasn't aware that it was also looking at online pharmacies. I guess that partly explains why the validated devices numbers are lower. There's a question about, we talk about validation being like, hey, it's validated, it's accepted, but do we know what proportion of unvalidated blood pressure devices are clinically inaccurate? Is there anyone who has looked at that? If you're aware, Dr. Picone?
It's a great and important question to ask, because I think what we can say is that devices that are not validated, there's no evidence. We just don't understand how accurate they are. So there are some studies which have looked at, I guess, devices that people own at home typically, and they've been brought into a specialist hypertension clinic or a research clinic, and they've been examined for a number of different things, and different investigators have run slightly different measurement protocols around this, comparing to the patient-owned device to manual auscultation. Typically, the studies find that a greater percentage, no, let me rephrase that. If we're looking at, say, the number of devices that are within 5 millimeters of mercury of accuracy, a much greater proportion of validated devices than non-validated devices will meet that threshold. There's also evidence that validated devices, there's less variation or variability in the measurement accuracy. And from static calibration testing, so that's where you're just testing the pressure transducer at different levels, there's also evidence that validated devices perform better than non-validated devices. Taking into consideration that these are home blood pressure devices owned by people that could have been owned for 6 months or 10 years, and there's a whole range of factors, but generally that is what is seen.
Indeed, I think you showed one study, and there are others like that, and we had done something similar showing that blood pressure devices in use may really vary for factors beyond validation. Validation is perhaps one of those factors. But you mentioned calibration, and there are a bunch of questions there about the devices may be validated, patients have bought them, but sometimes there is still a discrepancy. Is there any standard, or should you be checking for that? Are there any clinical suggestions about that?
Yeah, so certainly validation is performed in a general population, and that doesn't necessarily, unfortunately, mean that for a specific individual that device will perform accurately. I guess validation is a really good quality control measure, the sort of minimum standard of accuracy you can think about it as. What is often recommended, and there was a couple of papers published quite a number of years ago now. I can pull them out if anyone's interested, but around proposing a protocol for clinicians, a practical protocol that if a person has bought a home blood pressure device, they can bring it into the clinician and have it checked against a manual measurement. So that's sort of an individual calibration, if you want to call it that. So that is another level of checking that could be completed.
Exactly right. And again, so we have a tertiary care referral center in Ottawa here, so we are able to have the luxury of spending 30 minutes checking that. But it's a pretty rigorous process where you need to have a calibrated device in your office and use the patient's device and do it sequentially in the same arm, because there is a difference between one arm versus the other. So you have to put one device, check it, put the other one, check it, and just one measurement is not enough because there will be some variation. So you need to do multiple readings, average them. So it's not for the faint-hearted, a person with 5 minutes to spend measuring blood pressure with that patient. But yes, if you are, if there are protocols out there for individual patient calibration, as Dr. Picone mentioned, which could be used here. There are a bunch of questions about the cuffless devices and Apple Watch and stuff like that. I know, there's one that has been FDA approved, as far as I know, from one of the brands. But is there anything else you could share about, the accuracy of these cuffless devices? And there's a question specifically of Apple Watch. I'm pretty sure Apple Watch has not been validated, or they are not making claims for blood pressure measurement, are they?
At least in Australia, as far as I'm aware, Apple does not have a function to measure blood pressure. I'm not sure about Canada or America. I think certainly ECG and blood oxygen, I think, might be rolled out now. But cuffless, I can comment on cuffless devices from some recent literature that I nearly put in the slides, but I decided not to because it wasn't there weren't formal validation protocols, but it was some really interesting studies around, it's just been published in Journal of Hypertension, comparing a device called the Actia to 24-hour measurements. And the daytime tracking, or the daytime agreement, so ambulatory monitoring 24 hours, daytime and nighttime. The authors found that daytime it was okay, but it did not track the nighttime, the circadian rhythm of blood pressure. It did not track with the the nighttime decrease in blood pressure. And so the difference across the nighttime period was about 15 millimeters of mercury. So quite huge. And there was also some very preliminary data, perhaps suggesting that the cuffless device didn't track changes related to titration of medication, but that was only, I believe, in a couple patients. So there's certainly much more data starting to emerge in that space, but I think some people who are related to writing validation protocols have mentioned we need to really think through these protocols first.
Absolutely. There is a question about situations where the arm size is extremely large, or conical, where the upper arm cuff may not really fit properly, or may not be compressing the artery completely. I know Hypertension Canada has a recommendation a couple of years ago, actually about now 4 years ago now, saying that in these kind of situations it may be acceptable to use a validated wrist device. So there are wrist devices which are validated. Again, it's not perfect. Wherever you can use an upper arm, that's preferable, but sometimes in these sort of situations with the conical arm, the upper arm devices may give you slightly more inaccurate readings compared to a wrist. What are your thoughts about using a wrist monitor in such settings? Overall, people say, we say don't use wrist. I think this is one exception to that.
I fully agree with you, to be honest. I think that it seems like a pragmatic solution to that challenge, and it is clearly, the literature is, it's very, very clear how much of a challenge the issue of upper arm cuff measurement is in people with extremely large arms. So I think one of the concerns perhaps around the wrist cuff devices is the making sure that people really understand what they need to do to use them. So educating your patient around, so firstly having a validated device, but then making sure that you're using it according to recommendations. So measuring at heart level. I think there are now some wrist cuff devices which use sort of inbuilt sort of heart level sensors, which are quite neat. We've tried a couple of those in Australia that work really well. So education, I think, is the key there.
Absolutely. Yeah, there are, and maybe I can involve the Hypertension Canada president now in some questions. People are asking about, what are we doing to increase the awareness of the public? A, and B is, what can we do more, right? Why can't regulatory authorities take this question more seriously?
Yeah, great question. Well, I think it all starts with this webinar. Trying to get the awareness out there. We, as Jonathan showed, we're doing pretty well, but we need to be better, especially with the online. And I think awareness is a big part of this. So simultaneous with this, we have sent out a press release, and it's going to be picked up, I think, by a number of outlets. And so here's where it starts to educate the public. We have a good turnout of healthcare professionals as well, and so that's a good start also. But there is a lot more to be done. We also need the manufacturers to submit their devices to us as well. And there's a lot of devices that we have not reviewed because it has not been submitted to us. So those are the kinds of things that we're doing, and very open to suggestions that people might have. This is, as I said, the start of it, increasing the awareness.
Exactly right. And from my experience, at least, regulatory authorities are not necessarily interested in this validation question, right? All they look at is safety or some technical standards. They are not looking at how well something actually measures, which is, as clinicians, this is so important because we are making decisions, clinical decisions that may harm or benefit patients, as Jonathan alluded to, if we have inaccurate readings. But somehow that message doesn't seem to reach regulators. In this special issue that you mentioned, Dr. Picone, you mentioned about, this validation listing was one of several things you talked about. Is there any movement from the World Hypertension League or other associations to, get regulatory authorities involved or interested in doing something more?
Yeah, I think there are a number of steps that are sort of in train through different organisations. I personally wasn't involved in that call to action statement, so that was led by Professor Sharman and Professor Campbell from Canada. One thing we have been doing, I guess, in the region of the Americas, through the Pan American Health Organization, the Hearts in the America program, we were really starting to work quite closely with governments there, and there was a lot of interest in sort of some initial steps to start to take steps to regulate. So there is also a paper in that special issue about country experiences of countries and the ministries of health within those countries on the steps that they've taken towards regulation of devices. So yeah, really encourage people to have a look at that. So there's some of the early steps, and that's involved some of these organisations like the World Hypertension League and others to really try and have a concerted global effort.
Yeah, and it's going to be a long journey, but I guess the data that you and Jonathan showed today are sort of, the initial steps in trying to raise the awareness and importance of this issue for everyone. There are a few interesting comments. One about, we should be holding fast food giants accountable for hypertension. Yes, that's a really excellent point that we will all agree with. There are some things we can change and some things we can't. So let's focus on those that we can. There's another comment about, someone who bought an unvalidated device but still got accurate readings, and good for you. But that may not always be true, right? So that's sort of, we have a base with these validation studies of having something that's probably acceptable to begin with. There's one question about, when a device is validated, for how many years should that be valid for? And again, I'll pass that to Dr. Picone, but as far as I'm aware, if one device is validated after having done a validation study, unless something is changed in the device, the validation remains remains valid going forwards, unless they change some component of that device. Am I right?
Yeah, absolutely. Yeah. I guess the only nuance there is, while we're in this kind of transitionary period through which Hypertension Canada, it sounds like you're about to release next week your updated recommendations, where there were many different protocols. Now that we've just got one, we're moving forward in one direction, and there won't be any confusion, I don't think. So
fantastic. So it looks like that is all the time we have for questions. There. Thank you again to all our panelists for staying on and answering all the questions very patiently. The bottom line, of course, is that we are concerned over the preponderance of unvalidated blood pressure devices that are available. Canada may be better than the rest of the world, especially, I was concerned with the role of Australia in that global chart that you showed. So we can preen ourselves for seeming to be better, but the glass is half full or half empty, right? So more than half the devices being sold at online retailers for Canada were still unvalidated, and this sort of highlights the importance of our recommendation program, of course, to help guide the public to purchase these devices. Thanks again to our speakers, Dr. Picone and Jonathan Chan. We would like to thank all the attendees today for staying on, and we hope this webinar was useful. And if you have any further questions, please feel free to send them to info@hypertension.ca. We'll be sending you a survey that will ask you about some evaluation for our webinar today. There are some comments for our staff which we'll pass on from the Q&A. But thanks, and thanks for attending today's session.